Hello and welcome. My name is Dr. Brian Boyce, and I am the Residency Program Director for UT Health San Antonio, Department of Anesthesiology. We have a great residency program here, which is a 4-year categorical residency where we take 16 excellent anesthesiology residents every year. Our residents experience a variety of cases and a diverse patient population. The types of cases that we see here are level 1 trauma for pediatric and adults, high acuity OB cases, complex cardiothoracic surgery cases, as well as very complex acute and chronic pain management cases as well. We have 3 main sites at UT Health San Antonio: the University Hospital, the VA Hospital, and the Children's Hospital of San Antonio. Our residents spend the majority of their time at our biggest hospital, University Hospital. At this site, we treat a complex range of different patient populations, as well as different disease pathologies. At the VA, we treat a much smaller patient population that is unique and diverse in its own way. And finally, at the Children's Hospital of San Antonio, our residents are able to develop their pediatric experience and become comfortable taking care of children during their anesthetics.
Hello, my name is Crystal Manahar, and I'm the Associate Program Director for the Anesthesiology Residency here at the UT Health Science Center in San Antonio. One of the unique opportunities available to our residents is the Master's in Business Administration degree, which can be completed concurrently with residency training. Interested students complete the required coursework in their 3rd and 4th clinical years. Students also receive credit for classes already taken in the college and medical years, so that there is a 25% reduction in coursework compared to other programs. Our MBA program is notable for excellent professors, low cost, and easy in-person and virtual accessibility. The MBA program offers the opportunity to further your anesthesiology career by building leadership and administrative skills to further advance healthcare policy and run an organization.
My name is Martin Littlejohn. I'm a clinical assistant professor of anesthesiology and critical care medicine here at UT Health San Antonio. I came here for medical school. During that time, had a good interaction with the Department of Anesthesiology. I decided to stay for residency. It really enjoyed residency, good cases, a lot of good training. But at the end, I decided I wanted to do critical care medicine. And although we have a program here, I decided I would branch out a little bit to go see what else was out there. So I went to University of Alabama, Birmingham for critical care medicine. At the end of my fellowship, I decided to look around and see what was out there, and ultimately decided that UT Health San Antonio was the best place for me. They have a very positive outlook, great residents, great faculty, great facilities, and a lot of good cases here. San Antonio is a city that grew on me during my years here, and I found that it's a great place to live and work and have a family.
Hey guys, my name is Mustafa Maida. I'm a 4th-year anesthesia resident here at UT San Antonio. I'm one of the chief residents. First off, it's a level 1 trauma center, so you get all the experience that you need clinically. And I think getting level 1 trauma experience is something that differentiates you from other anesthesiologists who may have trained at an institution that does not have level 1 trauma experience. So you get to see all kinds of emergency airways and be comfortable at handling them towards your 4th year.
Hi, my name is Isaac Zock. I'm one of our chief anesthesia residents this year. I'm interested in chronic pain, and we have an excellent chronic pain program here at UT Health San Antonio. And I really wanted to have the opportunity to get my foot in the door for fellowship purposes. So those are a couple reasons why I chose the program here. And, had a great experience. I love the program, and hopefully we'll see you soon.
Our residency is structured in such a way where our residents develop increasing autonomy each year of their training. During the intern year, our residents rotate through a transitional internship consisting of rotations from the medicine side, such as medicine wards, cardiology, and the medical intensive care unit, and the surgical side, including surgery, CT surgery, as well as the surgical intensive care unit. Of course, you also have some rotations with anesthesiology, including our preoperative clinic and the boot camp for anesthesia, where we have an intensive didactic curriculum during the final month of the intern year to prepare you for the CA1 year. During the CA1 year, this is a year where our residents develop a strong clinical foundation and seeing a variety of different cases and case types prepare themselves for the rigorous CA2 and CA3 years. During the CA2 year, our residents start to experience the subspecialties of anesthesiology, rotating through cardiothoracic anesthesia, obstetric anesthesia, acute and chronic pain, and the regional experiences as well. During the CA3 year, our residents master the most difficult cases, as well as take on a more supervisory role with their junior residents. When our senior residents are on call, they act as junior faculty, being able to help direct our more junior residents through some of the most challenging cases overnight. This allows our residents to come out of training well prepared to either join a private practice and do their own cases, as well as join an anesthesia care team model where they'll be taking care of patients in concert with CRNAs, AAs, or in an academic practice with residents.
As our university hospital system continues to grow, our anesthesiology department has embraced expansion. We have incorporated 2 engineers to review operating room utilization and scheduling to improve perioperative efficiency. We also continue to build our pre-operative clinic and acute pain services. Our residents' clinical experience is outstanding. They participate in high volume, high complexity cases and provide care for acutely ill patients. As a result, they are strongly prepared for work after graduation in the real world, whether that be in an academic or private practice setting. Many residents also choose to go on to fellowship and have no problem matching into highly competitive fellowships of their choice.
Our institution has 2 different fellowships available for our residents. One is the Chronic Pain Fellowship, and the other is our Critical Care Medicine Fellowship. On the chronic pain side, our residents and fellows rotate through our chronic pain clinic, where they learn a variety of different interventional techniques, from epidural steroid injections and facet procedures, all the way through more advanced neuromodulatory and ablative techniques as well. In addition to this, they learn different techniques in pharmacology, as well as physical therapy, and other modalities to help treat the chronic pain population. From the critical care medicine side, our fellows rotate through the VA Surgical Intensive Care Unit, which is manned by anesthesiology, as well as over at University Hospital through multiple different intensive care units there, and then also different units over at the San Antonio Military Medical Center. These combinations allow our residents to experience a variety of different techniques and experiences that otherwise may not be available to them.
I really felt a strong sense of camaraderie amongst all the residents and all the faculty, and during my interview I noticed that a lot of the faculty and most of the faculty were very approachable, and that's somewhere I wanted to work with. I wanted to work in a collegial environment where I wouldn't be afraid of asking a question or asking for help anytime I felt like I needed it. Really happy with my experience here. I feel like I'm going to be well prepared for fellowship. And if I decide to do private practice anesthesia, I feel like I've obtained the experience I needed to succeed in that. Good luck on your applications, and hopefully we'll see you soon.
As a resident of San Antonio since 2014, I can honestly say this is a wonderful city to live in. Even though it's the 2nd largest city in the state of Texas, not many people know much about it. For me, San Antonio is the hidden jewel in the state of Texas. We are also the 7th largest city in the country, and we have much to offer in terms of restaurants and activities like the Riverwalk, the Alamo, the Zoo, Six Flags, and the Hill Country with its majestic views and opportunities for hiking. San Antonio is also a very affordable and family-friendly city with an international airport that makes it easy to travel. I hope it is clear that our anesthesiology residency here in San Antonio has many wonderful opportunities for you. We welcome you to learn more about our program and join us here for the excellent clinical and academic education.
In conclusion, at UT Health San Antonio, we have outstanding clinical and didactic training with energetic faculty to help teach you the art of anesthesiology. We also have innovative tracks to help make you the future leaders of our field. And finally, we have amazing residents who truly want to help the people of South Texas. I hope you consider us for your residency training program, and I hope to see you in the future.